So it's now a great pleasure for me to announce the last session of this day. It's the Global Digital Health Partnership panel we have arranged. And I would kindly ask our panelists to come to the stage. And I believe we also have US in the line. Can we see them on the screen perhaps? Just take a seat, yes. We don't see you, but do we hear you, Stephen?
Hi, can you hear me?
Oh, yes. Okay, at least we can hear you, Stephen, but we don't see you. Ah, now we see you. Hello. So I may introduce, this is Stephen Bosnack, the Deputy Coordinator of the US Office of the National Coordinator. Hello, and I think you also have a colleague with you, John de Moore. Are you here?
Yes, hello, great to be here today.
Yeah, hi. This is John de Moore. He is an advisor to the ONC on the topic of IPS, which is a work item of the GDHP. And here on the side, we have three other guests. I start with you. This is Jos van de Bay from the Ministry of Health of the Netherlands. We have Annatina Foppa from eHealth Suisse and Karl Leitner from WHO. And I'm still Jürgen Brandstaetter, but I'm here now in my role as the representative to the GDHP out of the Ministry of Health of Austria. So I have another hat on, and I grab me a chair. And I'd like to go immediately into the moderation. And the first word I would like to give to Stephen. The US is currently the chair of the GDHP. And Stephen, could you give us a statement what the GDHP actually is and how the US is, let's say, carrying it into the future?
Yeah, absolutely. I guess it's flipping back to me. Good to see some colleagues that I recognize already on camera there, and a pleasure to be with you. Sorry I couldn't be there in person, but I think all of us are adjusting to having hybrid sessions now, which is going to be the new normal for a lot of us. But wouldn't have missed out, and I appreciate Jürgen for the invitation to come and speak to you all today. So the GDHP, which may be a new acronym for some of you, stands for the Global Digital Health Partnership. It was created in 2018 and is really an informal organization, as much as one can be organized but still informal, of governments across the globe that have their digital health experts come together, join in, share strategies, information, resources about how we can advance digital health across both our domestic interests, but as well as collaborate better internationally. And so it really marries some of the deep technical work that you all do at IHE, all the way up to the tippy top of the policy layer, where many of my peers in the Global Digital Health Partnership operate as part of their ministries of health, or in my case, the Department of Health and Human Services. We each have missions, roles, responsibilities to citizens in our jurisdictions to help advance health information technology and digital health across our domestic interests. But all of us have a portfolio that involves keeping tabs on what's going on internationally and how we can better facilitate digital health adoption, commerce, economic competition, innovation, and similar types of standards-related work, which is some of where I'll get to my colleague John in just a minute. I like to call us the Government Geek Squad as a shorthand in terms of GDHP, because we just jump right in to IET profiles and fire profiles and terminology services and all sorts of other discussions that at a government level, really talking to my peers and other colleagues that are well steeped in the actions that we've got to do today and into the future. So that's a brief bit about GDHP. If you're from a government member and you're interested in joining GDHP, feel free to get in touch with me or anyone else that may be locally close to you. We did launch a new website recently, so you can go to gdhp.health. It's pretty nifty. And one thing I can just note, as Jürgen teed up, the United States is serving as the chair and secretariat for the GDHP for this 2022 and 2023 period. So we have 2-year terms as chairs. I know what it's like to be a political appointee now, because my term is almost halfway over now, and that really gets to what we're trying to accomplish. So one thing that we're trying to do is build out our membership in general, establish some additional strategic partnerships, trying to advance some activities that we can do as a membership as a whole, and that's where the International Patient Summary fits in. And so just building that community and the bond between the government members of your digital health units across the ministries is really important to me and our team at large. So as I go to segue in to flip it over to John to give you just a quick synopsis of some of our deeper IPS work together, just know that we have 5 work streams. They're represented on the website. They have some white papers that they've published in the past as well. Cybersecurity, obviously top of mind for all of us on a day-to-day basis. Evidence and evaluation, policy environments, and clinical and consumer engagement are the first 4. And then we have an interoperability work stream, which is quite busy and keeps a lot of my teammates, I don't want to say up late, it gets them up early on the East Coast of the United States to join in with many of you. So let me turn it over to John to give you a brief update on what we're doing from an International Patient Summary record.
Absolutely, and thank you so much, Steve. The work of GDHP and the interoperability workstream, while not only focused on IPS, a lot of that focus is IPS in terms of being able to coordinate a lot of activities across the multiple standards development organizations. So, Steve said it right. IHE, HL7, SNOMED, WHO, and a whole host of other organizations that are really involved with the advancement of the IPS, as well as those nations. The GDHP is made up of 33 nations and also 3 international organizations participating with GDHP and really making a common commitment towards advancing those 5 work streams, but also around IPS from an interoperability perspective. In terms of some of the specifics that we've done over the course of the last year, we've hosted some GDHP mini connectathons. I know some people on the line, probably some people in the audience, have had a chance to join some of those, and those are very exciting events. We've tried to open that up, so if you are a person or a participant in a GDHP member nation, we really are interested in having participation in those events, and it really works around some of those issues for IPS and really understanding where we are for implementation, what feedback we need to take to the standards community, what questions we have. And there are some real big questions that won't necessarily be addressed by any one standard, but will be addressed through a lot of common work over the coming years. One thing that's come up is around language translation and how do we actually start facilitating that? And harken back to one of those things that Graham said earlier, is that the terminology in IPS, because we define content in the International Patient Summary and we use terminology, it's a very important element in being able to get the semantics of that right, being able to use things like ontologies, like SNOMED, and being able to reference what they've done. SNOMED has released a freely available IPS terminology, which is a sub-ontology of SNOMED that has a lot of those terms that can be used both by SNOMED affiliates and also by nations that aren't SNOMED members for it. So advancing the terminology has been one vein of work. Having connectathons, one vein of work. We also support HL7, IHE, and other nations that are having connectathons across the world. In the realm of the feedback towards the specification, we're actually in a relatively final steps of a process of doing a publication update to the IPS based upon a lot of that feedback that we've received over the course of the last 12 to 18 months. For things. But also one of the other things that Graham talked to earlier, which I think Graham did an excellent job outlining, is talking about the IPS in regards to IPA as well. Because they share 2 letters, IPA versus IPS, people say, well, aren't these the same thing? Aren't these, are these competing standards? And I think Graham said it right. We really gotten out the word that these are standards that exist in harmony. One is focused upon how you get it without a lot of specifications on what it is. And the IPS in itself, it being a very document-oriented, content-focused way to receive that information. But of course, both operating in the context of FHIR. So lots of activity and lots of work there, but I'll hand it back to Jürgen to have the other panelists go as well.
Well, thank you, Stephen and John, and thanks, Stephen, to US at this point, because the US is our well-respected chair, and I really can say they fostered this partnership very much. Thanks for all of your support. I would like now to move over to Carl from WHO, and I remember I was there in 2018 when the GDHP was inaugurated in Canberra, Australia. And the WHO was part of the initiative from the very first hour. So from the perspective of an entity like WHO, which is a global player for health, and eHealth is a part of it, what are you expect? What is your reason to participate, and what do you expect of something like the GDHP?
Thanks for the question, and thank you all for the opportunity to be here. I think there's a number of aspects here. One, to understand, WHO is a member state driven organization. So everything we do is based on member state initiative and priorities and needs. Functionally, with the GDHP being composed of country membership, and it's a very natural fit for the way that WHO interacts and operates under our mandate. I think some of the exciting things that we are getting out of GDHP is those relationships with the IT digital health leadership across multiple government organizations, and not necessarily be limiting to sort of one sector, one geographic sector. I think going forward, we do encourage and look to the expansion of GDHP membership particularly to low and middle income countries. That is one of the sort of underserved areas and under-resourced areas that we're looking forward to. So we've seen some nascent interactions and joining to GHP and looking forward to expand that. A lot of what WHO is doing in digital health is guided by a digital health strategy that's now come out. It's a 5-year strategy. And there's a number of areas that really align with some of the tenets and principles that are within GDHP. Things like capacity building, improving governance, and ensuring that there is the ability to exchange data across borders, across health systems, across jurisdictions, really aligns to a lot of the efforts that we want to do to accelerate the uptake of digital health in low and middle income countries, to provide improved access to healthcare and health service delivery, as well as to take on roles of public health surveillance, particularly with the epidemics and pandemics that are affecting us all. Some of the other things that to call out that we're looking at very closely are things like the International Patient Summary, and some of the work that we've done around COVID credentials, building off of what the work has been done by multiple jurisdictions, really thinking about how do we take these networks and jurisdictions that are interacting in a trusted network and a secure exchange of health documents, and how to do that is, I think, one of the key challenges that we have going forward. How do we do this in a way that doesn't force particular jurisdictional policies across upon one jurisdiction versus another, and really thinking about what is that interoperability and exchange. So we've worked a lot on aligning multiple the projects and strategies of WHO to standards interoperability. A few things to highlight are a work called SMART Guidelines, which is really taking the normative guidance that WHO produces and PDF documents and trying to digitize that in a very structured way. Sort of one of the key outputs being FHIR implementation guides. That's building off of things like the IHE, the IPS, and having the GDHP community to be a part of that and understanding where countries are going, so we can align our efforts there is a very important aspect for us. We're also looking at key, not just the health content and the guidelines, but key metadata issues. So for example, with ICD-11, we now have and are working towards the compliance of the ICD-11 with the IHE profile sharing value sets and concept maps to accelerate the adoption of ICD-11. We're also working on a global health facilities database. We're looking very strongly at the mobile care services discovery IHE profile that to express and share out that data. So seeing what's adopted in the community and having the GDHP as a platform so that we know that we're building both for low and middle income countries as well as high income countries in a way that doesn't have a divergent path for these different segments, I think is a key way that we can ensure that we have global interoperability and strong digital health infrastructure going forward. Thank you.
Thank you, Carl. WHO is one of the few members of the GDHP which is not a country. So there's OECD is the other one. And there is also DR, I don't know, it's another more AI focused association, but the majority of the members of the GDHP are countries. And I would now lead over to Annatina from Switzerland. Switzerland is also part of the GDHP. My question to you is, Switzerland is in the middle of Europe, but it's not part of the European Union. So you are formally not bound to all of the eHealth things which the European Union is doing. So can you talk a little bit on your motivation to be in the GDHP in the light of all of this? Is that your chance to participate, or how can we understand that?
Yes, of course. Now, you're saying we are not bound to the EU regulation as if this would be a good thing, but actually we're also excluded from all the knowledge within the EU. Like we were a long time, we were part of all the EU projects, we are very engaged also in EPSOS and everything. But then in 2018, due to, or for political reasons, so at the time where Brexit was discussed and everything, and politics got a little bit harder on non-member countries. So we were excluded from the eHealth network. And so suddenly we lost all the connection to the international community, which would be so important, as everybody knows in this room, otherwise would not be here. We are a little bit lost and shocked. So we are very relieved when in 2019, the next year, we are approached by GDHP, I think by you, Jürgen, with an invitation which we took up very happily. And but to say it's not just a replacement for the lack of the EU collaboration, because we also could discover with GDHP that there is like a fresh breeze of collaboration. We could feel, I mean, there was a very strong drive, and I think maybe the reason is that there is not a big organization behind, which has existed for a long time, but really a consortium of member states who want of states and organizations who want to have a common goal. So we were also impressed by that. And besides, the topics which GDHP addresses as interoperability and patient access are the same who are of concern for us.
Yeah, thank you. Yeah, and as you mentioned that, yeah, I was so excited about this initiative that I sort of did a sort of marketing tour, and I told you guys about this, and thankfully you joined in, which was a big win for the initiative. Now there are also some others. I think Netherlands also joined at that point of time. And Jos, you're from the Ministry of Health in the Netherlands.
That's right. Yeah.
And the Netherlands are very active in the GDHP. Yeah, I've heard that the next face-to-face GDHP summit, we have some regular summits, They were unfortunately interrupted by COVID, which was a big loss, to be honest. And the next one is in Rotterdam, right?
Yeah, that's right. 3 to 5 October, the next face-to-face summit will be held in Rotterdam. We've been working really hard to put together a nice program for all GDHP members. We've been working really hard with Steve's team. And hopefully it will be a meeting like this as well, where we can reconnect, and there's a lot of time for people to talk to each other. And of course, all the work streams will have time slots to talk to each other, and there will be room for some site visits. As you might know, Rotterdam is the main harbor in the Netherlands and even in Europe. So we hopefully have a site visit to the Rotterdam harbor, but also to the Erasmus Medical Center. And I hope everyone that hasn't applied yet and is a GDHP member, please come to Rotterdam. And of course, it will be hybrid. So if you're not in the position to come to Rotterdam, you can always join virtually.
Yeah, thanks. We are all very excited about this because in the past these meetings were very fruitful, and as my colleagues already said, I mean, this is it's an informal gathering of countries. So no one is forced to be there, but yet the ones who are there stay there, and this has a reason, because they can go at any time. And the reason is because everyone there has understood this is a forum to help each other. You see that the 5 work streams, they are not only on interoperability, they are covering all the issues a country has when they want to establish a health information exchange, policy environment, clinical and consumer engagement, how to get my doctors on board. You know, these are all real problems a country has. And this initiative is dealing with all of them. And there are so many, you know, fruitful brainstorming talks, not only in the sessions, but also in the breaks. So that is really a very vibrant meeting, and I really hope, I don't know, really look forward to Rotterdam, to be honest. And I think you might have a little surprise for us, yes?
Yeah, as Jürgen mentioned, we are a very active member of the GDHP, and we are also the only ones applying for the co-chair position at the GDHP. So hopefully we will be together with the US, continue this journey at the GDHP. And we are really looking forward to, because the GDHP does not have a lot of members from the European Union. So we really hope to bridge that gap between the European Union and the international perspectives, because I believe we are all facing the same challenges, whether it's national or on a European level or an international level. And as we are also the co-chair of the eHealth network, we hope to build those bridges between all different levels.
Yes, that's true. I mean, the series of chairs was Australia first, then it was India, now it's the United States, and with Netherlands we probably will get the first European co-chair of the GDHP. Makes me very proud as a European to say that here. We have time for a last statement. So Steve, would you want to say a last thought to us before we maybe go into a Q&A round?
Sure. I mean, I appreciate everybody's collaboration. Certainly the warm words from all of my other colleagues about the Global Digital Health Partnership. You know, there's a lot going on globally, and I think that's important for us to reflect on. IHE plays a really important role in advancing certainly how the technical connectivity happens across the globe. You know, and it's deployed in various different ways in various different jurisdictions. I think, you know, making sure that we all from a government level are plugged in to the efforts, either via the mini connectathons, other types of athons that occur. those are all things that help us stay connected and stay together. And so I would just encourage you to keep that up. It's great to see that, you know, in-person sessions are starting again. And I know all of us have looked forward to that. But then equally, you know, being able to make sure that we share what we're working on, even though it's in a hybrid capacity. So I just want to say thank you for your continued, you know, efforts in the space. I know every day it seems like we're kind of toiling away, but when you do pick your head up, you do see, you know, we've made some tremendous progress over the past, you know, 5, 6, 10 years.
Thank you. Carl?
No, I mean, I think there's a lot of opportunity here, and I just look forward to the GDHP's continued work and collaboration and really bringing the countries together. I think, you know, we have a 5 to 10 year vision and to really try to transform how digital health is done. And I think GDHP is one of the key collaboration networks, and that's going to help us do that and to build that trust across countries so that we can, as global citizens, really have access to our personal health records and use them as we travel and ensure that we have interoperability of systems. So thank you.
Annatina?
I think I would just ask GDHP to remain or to keep the spirit you built up in the last few years, or only 3 years, like as a very uncomplicated and informal organization who wants to move forward. Since you observe it, that the bigger organizations tend to become a little bit like the inertia is a little bit higher. So I'll ask the GDHP, and we try to participate in this as well to keep the drive up.
Thank you, Jos.
I just want to say, please come to the summit if you're a member, and it's on a boat. So that's really important to mention.
Yeah, seriously, it's on a boat. Yeah, but it's a big boat, I've heard.
A cruise ship.
Yeah, as for Austria, I can just underline what was said. We shall keep up this spirit. I mean, GDHP has so high-level connections, you know, to G7. 4 of the G7 countries are GDHP members, and also to G20 and to OECD. This is all a level where the GDHP is identified as the sort of the working entity when it comes to eHealth. You know, so some topics which are discussed in for example, in G7 summits are actually decided to, you know, let's say, defer to the GDHP to actually work them out. And I think that's exactly how it should be. And also the GDHP, which it already does, is talking to the standards development organizations. So, I mean, this sort of collaboration, I think, is exactly what we need for the future health challenges, because we are, unfortunately, still at the beginning. There are so many use cases which are not yet profiled, where there is not the sort of best practice breathed out. So thanks for your discipline in your speaking times. It was 2 disciplines. So, but we have now some more minutes for some questions. So are there some questions from the audience? Sophie, there is the microphone.
I don't know if my question is the right question. I don't know if I open a Pandora vessel. And international patient access and eIDAS regulation. Is it a Pandora vessel?
I don't think so, because these aren't totally different things. I mean,
are you sure there are different things? Because we are speaking about parted patient access, provide patient access. Now we learn there is this far international patient access, but we know that we have the eIDAS regulation. We know that we have to follow this rule in Europe. I'm not aware of the situation in the other state. By the way, in the G7, in this community, there are 5 countries from G7. There is also Italy.
5. I'm sorry.
Sorry. Take it as a joke.
I thought it's 4.
Thank you.
Yeah, well, to this topic, you know, I mean, generally, and I mean, we have the, I don't know, I say it's problem, but the situation that, for example, a country which is member of the European Union is confronted with a lot of European Union regulations, and they're coming even more now with the European health data space and so on. And when you look in the ministries of EU countries, the first reaction is, you know, we have so much work to do to catch up with all things which are asked from us from the European Union. And I say, yes, that's a fair comment. You know, we are all struggling with resources, but I think, you know, at least with a blink of the eye, we should have an eye on these international developments, because finally the world does not end on the borders of the European Union. Some, you know, use cases we are dealing, for example, with in the interoperability work stream, where on IPS, for example, how can I supply a citizen of a country of the world to get their health data with them, even if they are not part of such a very high sophisticated health data exchange space as the European Union is probably soon be. But if they go to, I don't know, Argentina or to Uruguay, which are also members of the GDHP. And so from my perspective, it makes definitely sense to have an eye on this. Stephen, do you have a comment on that?
I mean, I would certainly agree with your points, Jürgen. I mean, I think anytime we do something internationally or globally, it takes more time than we want it to. But I think as we reflect on the slow incremental progress, that's really, you know, a sweet spot for all of us, recognizing that there are different levels of investment, different prioritization that occurs depending on, you know, who's in charge of the ministries and whether or not they want to invest more or less in, you know, global interaction. So all of those things that, you know, we try to juggle with some level of continuity and continued support through, you know, the GDHP related membership and you know, connections that we can build through, you know, through our organization. You know, and keeping in mind the different maturity and readiness across the members as well. I think that's been one of the things that I've enjoyed personally in being able to interact with many of them. I've set up some one-on-ones, you know, the Zoom like this gives us a great opportunity to talk with people, you know, all around the world, so long as we can match time zones. To really get a sense, there are a number of countries, as many of you know, in your IHE work and elsewhere, that are working on their digital health strategies now for the next 3 to 5 years. And so as we help sharpen that, either through keeping them up to date on what's going on at a international, you know, cooperation level, those are all different types of advancements that we can make. And certainly, you know, Europe has its, you know, layers, you know, to deal with as well. And, you know, I would say the United States has similar but different phrasing for how some of those challenges work between federal, you know, investments and U.S. state level investments, and then private sector, you know, collaborations as well.
Yeah, thank you. So we have time for one more. Yeah, you were first.
If somebody has a more urgent question, was there another questioner?
No, just go ahead.
Okay, right. So I apologize for my lack of familiarity with the project. And if the answer to this question is on page 1 of your website, you can just brush me aside. But I'm interested in the different views on privacy and consent for patient data use, and that isn't homogeneous across every country in the world. And I'm sure you've thought about this.
Wants to answer?
I'm happy to jump in if I can say a word on this. I think that this has actually been a very active, you know, thought process and something that we've done for the GDHP interoperability work stream. The initial focus for a lot of the IPS usage is around this patient engagement and the patient-mediated transmission of this information, because that's been a common denominator across many of the nations. Is once a patient accesses their own information, they do have the rights and responsibilities to be able to bring that wherever they want to go in the world for things. But certainly, you know, Carl can weigh in on this as well. You know, being able to have provider-to-provider access is in the long-term sites. And we know of very big importance when you think about this international sharing of information. It is something that, you know, will be worked on over time.
Thank you. Carl?
I mean, I agree with all was just said. I think one of the other things that maybe just to highlight, we did come across this very directly when we were developing guidelines for the digital documentation of COVID certificates, where we were looking at all of the sort of implementations of COVID certificates. There's a whole section that outlines a number of ethical and privacy and security considerations that I think are definitely very applicable outside that very narrow use case. So I would look at that. I think what we sometimes struggle with is to figure out, okay, with interoperability standards, data exchange standards, technical specifications, where does the line between the technical specifications and the policy specifications, where does that line get drawn? And when does the technical specification sort of enforce a particular policy? And being very careful to separate that out is, I think, a challenge that we're constantly facing. And I think what we would like to see more of is, as maybe to the previous question, as technical approaches are taken, that the sort of interoperability needs are as separated as much as possible from the policy needs, because those policies do vary across country to country. And so as much as we can reuse the health content, the knowledge content across countries, the better, and ensure that there is space for, at the technical level, to enforce the particular policies in place. So I think that's one of the hardest challenges, where everybody says, oh, the technical is easy. I don't think so, because when we run into the policy considerations.
Okay, thank you very much. It's unfortunately time for us now to wrap up. So I thank you very much for your attendance at this panel, and especially to John and Stephen. Stephen, can you say something so that we can see you on the screen, because you only appear when you say so? Yeah.
That's right. Good to see everybody.
Okay, so many thanks for your time and for your insights. Also to you, Annatina, and yours. We're looking forward to Rotterdam soon. Many thanks to you, dear audience, for listening to us. I hope you had your fun. And by that, we close the panel. Thank you very much.
So with that, we are actually at the last point on the agenda, which is wrapping up and drinks. But before we can go to that, would like to thank you for your participation. I think we had a really excellent program, which gave a very comprehensive overview on what is going on in various European countries, also on the European level. Quite a few of you did participate in the VIP tours of on the Connectathon floor, and I can say that while we were in session here and during yesterday on the Connectathon floor, already 1,300 tests have been performed. 1,300 tests. And 700 of them have been already verified by the monitor. So every test has to be checked by one of the monitors. That's why this is a little bit behind. But this extremely well shows the very valuable work which is being performed during the Connectathon. Additionally, yesterday, 25 people did part in the IHE Certified Professional Certification exam. Unfortunately, we do not know yet how many of them did really pass the exam, because for some strange reason, they all decided to use the paper checklist, the paper questionnaire instead of the provided iPads. So they still have to be checked manually whether they did pass or not. What remains to be said, I think, is a big thank you also to the organization team for creating this very interesting program. especially also to the team from IHE Suisse, who had the challenge of organizing this all here locally, and also especially to the technical team, which really made this run absolutely flawlessly, which was really a challenge because of all these cross-Atlantic connections we had to establish for the later part here in the Experience Day. Which was really great. And I also have to say, this was already mentioned, the Connectathon is also connected to Atlanta, and there many of the tests which I just mentioned have been done across the Atlantic between systems which are running here and between systems which is in Atlanta, which is also quite a challenge to get this established. And most likely they cannot hear me, but also the IHE US team in Atlanta. Some of these guys got up at 4 in the morning to give support to the participants here in Montreux, which is, well, really a big thank you for that. Anything more from Jan?
I just wanted only to say that all of you who are still here, you all get extra 50 points because you've stayed until until the afternoon. All of you who were not punctual lose another 20 points because that was a little bit challenging. But what did we say in the morning? It's an experience day, hopefully. And you are the ones to judge if the experience was worth it. The fact that you are still here tends to indicate that it was. And although it was already said, I also wanted to thank the organizers because a lot of work went into it, and it's your job and your effort, and thank you very much. And it doesn't happen often that a Czech guy would be standing between you and the drinks, so.
Maybe one more point. Of course, we plan to redo this next year. So if you have some interesting topics that you would like to present, just let us know.
Thank you.
And now up to the drinks.